Mary MacDonald looks comfortable at the QEH because for a long time, it's been like a second home.
Mary was first diagnosed in 2012 at the age of 9 with acute myeloid leukemia. And she came here to emerge the first time, and she had a swollen neck. That's how they found out what was going on. So then we met Dr. Gaston, and then we went to Halifax the next day. Then we came back here, 5 months later we came back here. And then she relapsed with the same type of leukemia, and she came into for a doctor's checkup. He did her blood work and showed that the cancer was back. So then she was airlifted to Halifax that night, as they had called Halifax, told them what was going on. She had a bone marrow transplant in Toronto at Sick Kids in April of last year, so she's almost at her year mark for her bone marrow transplant. And when we came back last July, we were here every week, but she comes into the hospital 7 days a week because she gets an antifungal IV medication for her lungs, and that's continuing on until we're not sure how long. Just depends on her medications and so on, but she comes in every day.
It's been a tough time for Mary, but she can still find some enjoyment, thanks to the compassion and care of QEH staff.
Look what I did.
Shira does schoolwork with her and crafts with her and nail painting and all that kind of stuff, yeah. It's been a good thing for Mary. Like when we're here full days, she'll get her movie, do her nails. They've had spa days, they've done painting, they've done crafts.
So typically when patients like Mary come into the hospital, I usually greet them down in the day unit, and then making sure that they are well distracted while they're here. So some kids like Mary are here for quite a bit of time during the day, and so they can get kind of boring. So to make sure that they're well occupied, so whether that be sitting and doing an activity like crafting. Mary's a very crafty girl, so she really enjoys doing painting, and we have spa days, so she'll kind of get her nails bedazzled, and sometimes she'll kind of reciprocate. She's very much into that nail art and very talented with that.
Pretty similar.
When we work with Mary, you know, when we're doing our nail days and we're just being silly, to hear that laugh that comes all the way from the toes, it warms your heart, and you just know that you've done your job. And I can leave feeling that I've helped a family, even though medically I'm not involved in the infusions and the medical nursing piece of it, but I'm involved in making sure that she's laughing and she still leaves with a smile on her face, even though she's facing so many struggles.
You just can't put the infusion in this one. She'll spoil. She'll go moldy.